Assalamu alaikum. My name is Usama Suleiman, and this is our case presentation for Clinical Pathology Conference 622. Myself and my colleagues, Faisal Talik, Mahmoud Abid, Hassan al-Sheikh, and Khalid al-Shamrani. We will start with the general data for the patient. She is a female patient of 48 years age, and her chief complaint was bilateral pain that began a year ago.
This is Hassan al-Sheikh speaking. So after the chief complaint, we ran the history of the present illness, and we found difficulty in opening the mouth in the morning, which is also known as trismus, and which is described as limited mouth opening or locked jaw since 1 year. After that, we checked past medical history, and we found out that the patient is on oral biphosphonates, and we found a history of keratoconjunctivitis sicca, and also we found xerostomia, as well as stiffness of the joints on both legs and hands, which began 5 years ago. In addition to intraoral mucosal mirror test, which assesses the salivary flow rates, tested positive for this patient. And finally, we found decreased salivary flow from left stone zones, or the parotid glands duct. Following the past medical history, we checked the past dental history, and we found prevalent caries lesions, as well as halitosis and candidiasis. Following the dental history, we checked the family medical history. While the exact cause of Sjögren syndrome is unknown yet, it is believed to be a combination of genetics and environmental triggers. The patient was unaware of any familial history relating to Sjögren syndrome.
Clinical presentation. Clinically, the prominent features lie within the glands, specifically keratoconjunctivitis sicca, xerophthalmia, which is caused by a defect in the lacrimal gland, dryness of the mucous membrane of the mouth, xerostomia, which is caused by a defect within the salivary gland, bilateral parotid gland. Radiological interpretation. We have two photos. On the left side, you can notice an AP view. On the right side, you will take note of a lateral ceph. Radiographic interpretation continued. Fine beaded appearance on the left side of the mandible behind the masseter muscle within the parotid gland. Presents as apple tree appearance and may also manifest as salt and pepper appearance or honeycomb appearance. Extends into the interglandular ducts. Radiographic interpretation continued. The fluoroscopy imaging uses a radio-opaque contrast compound which is injected into the glandular ducts of the parotid duct and gives an apple tree appearance, which can be observed in the following video. This is a fluoroscopy on celiogram. Radiographic interpretation continued. Celography is useful to exclude the presence of obstructions or strictures, but the diffuse selectasis of Sjögren syndrome is seen in various other diseases and is therefore not specific. Selectasis, also termed selectasia, is cystic dilation of the ducts of salivary glands. The effects on the surrounding structures mostly manifest in the muscles and joints of the TMJ, which causes trismus.
Arriving at the radiographic differential diagnosis. The pattern-based radiographic differential diagnosis regarding the soap bubble and the honeycomb appearance that Sjögren's syndrome manifests as, we can arrive at 4 different differential diagnoses. Number 1, ameloblastoma. Number 2, metastatic tumors to the jaws. Number 3, odontogenic myxoma. Number 4, anumeral bone cyst. Moving on, you can see in the following table, we laid out our lesion and the 4 differential diagnoses, with each of the clinical features, radiographic features, and histological features. Regarding the present lesion, the clinical features include parotid enlargement. As to the radiographic features, it includes apple tree or soap bubble appearance. And the histological features are unavailable as it is an autoimmune disease. Moving on to our first differential diagnosis, ameloblastoma. Its clinical features manifest as a hard, painless lesion near the angle of the mandible. The radiographic features include an expansile soap bubble lesion with well-demarcated borders. The histological features are cell under or palisaded ameloplast-like cells and an inner zone of triangular-shaped cells resembling a stellate reticulum. Moving on to our second differential diagnosis, metastatic tumors to the jaws. The clinical features manifest as swelling pain and paresthesia. The radiographic features include a PDL which appears widened and a moth-eaten appearance. The histological features include neoplastic growth of a mixture of cells. Moving on to our third differential diagnosis, odontogenic myxoma. The clinical features include diffuse swelling with no clear borders over the angle of the mandible. The radiographic features include a soap bubble appearance, and the histological features include mesenchymal odontogenic tissue. Our fourth differential diagnosis, and our final one, is the anumeral bone cyst. The clinical features manifest as pain, which may be either insidious, which means spontaneous or acute, or it may be abrupt. Our radiographic features for anumeral bone cysts, it appears as sharply defined expansile osteolytic lesion, and the histological features of it are blood-filled spaces of variable sizes. Now moving on to the histopathological investigation of our particular disease, Sjögren's. Unfortunately, there isn't one test that we may utilize to arrive at a definitive diagnosis for Sjögren's syndrome. Instead, we must utilize and employ a wide variety of different means, such as clinical manifestations, signs and symptoms, and the history of the patient. Moving on to what we concluded as our definitive diagnosis, based on the clinical features of pain in the joints, xerostomia, and keratoconjunctivitis sicca, and based on the radiographic evidence of an apple tree or soap bubble appearance in the parotid gland, and also based on the patient's medical and dental history, including the medications she currently takes, aka the bisphosphonates, we arrived at the conclusive, indisputable, definitive diagnosis of Sjögren's syndrome.
And the way to manage this case is to try to decrease eye inflammation by prescribing eye drops increase production of saliva by prescribing some saliva-inducing drugs. If the patient develops arthritis, she will benefit from non-steroidal anti-inflammatory drugs. It's worth mentioning that hydroxychloroquine can be helpful in treating system-wide symptoms. Patients suffering from Sjögren syndrome are more likely to be susceptible to osteonecrosis of the jaw and more commonly found to be on bisphosphonate treatment. And to wrap up, the following are the references we used. Thank you for your time.